Hi, everyone, and thank you so much for your interest in the topic of trauma at the intersection of education and learning. Understanding what is happening at the intersection of trauma research and learning is truly the connection that can help you save lives. I'm honored to be here talking to you about this critical topic today. A brief intro to me before we get started. My name is Dr. Kathryn Kennedy, and I am an educator and an education researcher and consultant in the area of online, blended, and digital learning and have been for the last 20 years. I also work in the area of trauma-informed social and emotional learning for teachers and students, in addition to healing trauma through the practice of somatic approaches. I'm the founder of my own educational consulting firm, as well as the founder of an organization called Wellness for Educators that centers around the importance of well-being through somatic approaches, including but not limited to yoga, qigong, tai chi, as well as contemplative, reflective practices like meditation and mindfulness, and other more cognitive and therapeutic modalities such as cognitive behavioral therapy, emotional freedom technique or EFT, and EMDR, the tissues that hold traumatic experiences, such as adverse childhood experiences or ACEs, have the potential to be healed. Using my own experiences with severe ACEs, our organization provides strategies through educator professional learning so that you can empower yourself to work through and with your own traumas, secondary traumatic stress, and emotions to heal and be there for your students and colleagues, as well as to help them feel empowered to heal themselves. Wellness for Educators is invested in and passionate about supporting educators worldwide with trauma and equity informed practices and strategies for well-being and social and emotional learning through a variety of disciplines. We offer a wide array of professional learning opportunities such as book studies, webinars, a podcast, and micro courses, and we partner with educational organizations to provide educators with multiple perspectives, collections of tools, and a supportive community. We are dedicated to helping educators build resiliency. We also house an online wellness library at $25 per year membership, filled with short video, audio, and text-based guidance on self-care strategies from the disciplines of yoga, mindfulness, meditation, qigong, and more. You can learn more about partnering with us at wellnessforeducators.com. And now let's move on to today's content. We'll start off by acknowledging the obvious. We're stressed. We as educators are stressed out. We were stressed out pre-COVID, but because of COVID, we went into absolute emergency crisis mode to continue to serve our students, their families, our schools, our districts, and our communities. And we did this on top of also taking care of our own families as well. This has been an extremely traumatic time. We're going to start with a basic definition first of trauma. According to UCLA clinical professor of psychiatry, Dan Siegel, trauma is an experience we have that overwhelms our capacity to cope. Dr. Bessel van der Kolk, who serves as a professor of psychiatry at Boston University and who is the president of the Trauma Research Foundation, said, "After trauma, the world is experienced with a different nervous system." Dr. Albert Wong, who is one of my teachers, serves as the director of somatic psychology at JFK University. He says trauma is not just a cognitive experience. Everything that we're learning from trauma, from the most recent advances in neuroscience, from research on the relationship between trauma and so many different bodily disorders, such as autoimmune disorders, digestive disorders, endocrine disorders, heart disease, and more, our level of trauma impacts our level of stress. Trauma is not just a thinking thing. It's not just a prefrontal cortex or an error of executive functioning. And most of all, it cannot be simply resolved by cognitive reframing, no matter how hard we try, because trauma is embedded into our system. Trauma is a bodily experience, not just a cognitive one. Because trauma is a bodily somatic experience, something that impacts our amygdala, our heart rate, and our nervous system, we cannot simply solve trauma issues through cognitive work alone. We have to address the body. We have to try and help the body recalibrate on its way through trauma. The ACE study is telling us that mental health and physical health are correlated. The ACEs reports that among the 17,421 patients, childhood trauma correlated to serious adult medical conditions. According to Dr. Vincent Folletti, who is the director of the study, contrary to conventional belief, time does not heal all wounds, since humans convert traumatic emotional experiences in childhood into organic disease later in life. There are also a number of other traumatic events that can cause nervous system dysregulation, including a global pandemic, which we're in the midst of currently. If we don't work through these traumas and stress, they will stay with us and cause us to have health problems throughout our lives. Before I introduce the polyvagal theory, which was developed by Dr. Stephen Porges, who is a distinguished university scientist at Indiana University and the founding director of the Traumatic Stress Research Consortium at the Kinsey Institute, I wanted to show you the anatomy of the vagus nerve, which is the foundation for understanding the polyvagal theory. The vagus nerve is integral to the central nervous system. As you can see here, it hits every major system in our body, and it is essential in keeping you healthy as long as you can take care of your nervous system. So we'll move on to the polyvagal theory. We're focused on the idea of the window of tolerance. When we are triggered, we are outside of our window of tolerance. When we are numb, feeling hopeless, we are also outside of our window of tolerance. In these two spaces, no new learning can take place. Only within our window of tolerance can new learning take place, which brings us to why understanding these concepts is so important to the field of education. Bessel van der Kolk, who we introduced to you before, wrote a book called The Body Keeps the Score: Brain, Mind, and Body in the Healing of Trauma. And in one of the chapters, he focuses a bit on education. This book is one of the ones that Wellness for Educators focuses on in our book studies. Sadly, our educational system, as well as many of the methods that profess to treat trauma, tend to bypass this emotional engagement system and focus instead on recruiting the cognitive capacities of the mind. Despite the well-documented effects of anger, fear, anxiety on the ability to reason, many programs continue to ignore the need to engage the safety system of the brain before trying to promote new ways of thinking. The last things that should be cut from school schedules are chorus, physical education, recess, and anything involving movement, play, and joyful engagement. When children are oppositional, defensive, numbed out, or enraged, it's also important to recognize that such bad behavior, quote unquote, may be repeat action patterns that were established to survive serious threats, even if they are intensely upsetting or off-putting. This is truly disheartening for our students if they don't have access to these somatic outlets, but also take a minute to think about your own traumas. Have you really taken the time to work through them, to heal them in meaningful ways? This also reminds me of a quote that a superintendent I work with mentioned to me recently, which was, "You have to Maslow before you bloom." In a way, really going back to the safety system in the brain, as Bessel van der Kolk mentioned, because that's where we have to set the foundation of safety before we can promote new attempts at learning.
And now for a definition of social and emotional learning.
This definition is from CASTLE, the Collaborative for Academic, Social, and Emotional Learning. I'm currently working with them now, along with a statistician, Dr. Elizabeth Anderson, to update their measures. So they define social emotional learning, or SEL, as the process through which children and adults understand and manage emotions, set and achieve positive goals, feel and show empathy for others, establish and maintain positive relationships, and make responsible decisions. And here's a graphic to help illustrate all that is involved in SEL. So if we look here, you have the inner workings of what the learner works on, and then the many levels of support to help them with these indicators, because as we know, it takes a village. So not only is it important to have specific SEL curriculum and instruction, but you need to have those practices supported within the classroom, schools, and home and communities. And there needs to be partnerships across all of these spaces and stakeholders.
SEL can be impacted greatly by childhood trauma, and schools, districts, communities, educators, families need to be aware of this and be able to support students where they are at in order for them to best develop their self-awareness, their self-management, make responsible decisions, build relationship skills, and become socially aware.
This is a diagram to show you things that might manifest in a child's being based on their experiences of trauma. For example, young children who experience trauma may have difficulties forming an attachment to caregivers, experiencing excessive fear of strangers or separation anxiety. They might have trouble eating and sleeping. They might be especially fussy. They might show regression after reaching a developmental milestone. For example, they might not be able to sleep through the night, or their toilet training might go reverse. School-age children you might see aggressive behavior, or they might become withdrawn, or they might fixate on their own safety or the safety of others. They might reenact the traumatic event through play. They might have frequent nightmares or exhibit difficulty concentrating in school. For adolescents, as children get older, they might become anxious or depressed. They might engage in risk-taking behaviors or self-destructive behaviors like drug and alcohol misuse or dangerous driving, sexual promiscuity, unprotected sex, self-harm, or illegal activities. They might feel intense guilt or anger or shame. They might adopt a negative view of people and society. And in some cases, they might have persistent thoughts about suicide or seeking revenge. One of the most important things that we can do for students who have experienced trauma is give them the space to process and heal. And as Mark Brackett's new book emphasizes, giving them permission to feel. Oftentimes, children are told to not feel their emotions. They are told to think positively instead, when in reality, they should be processing their emotions so that they don't come up for them later. And these two concepts are toxic positivity and emotional bypassing. Additionally, when it comes to equity, we need to make sure that the students have what they need in order to be able to process these experiences in a safe place, as well as in a way that makes sense to them personally. Trauma truly changes our ability to adapt based on what it leaves behind in our physiology and nervous system. And we want to get to a place where we feel a sense of safety in our bodies, and that our students also do as well. And so PTSD narrows our lives, and what we can do is hopefully grow our window of tolerance in order to really experience post-traumatic growth, which will expand our experiences and expand who we are as a person. Some key trauma-informed SEL practices include, but are not limited to, creating predictable routines. So these are the ways that you can help your students in your learning environments. You can help them build strong and supportive relationships, empower their agency to make choices that make sense for them, give them the space to choose and have a voice in what they feel like doing in a certain time, supporting the development of self-regulation skills, and providing opportunities to explore individual and community identities. That goes back to the equity piece as well. We as educators also need to remember the 4 R's of trauma-informed care. We need to realize the widespread impact of trauma and understand potential paths for recovery, and that they might be different from one student to the next. We need to recognize the signs and symptoms of trauma in our students and others who are involved, like their caregivers. We need to respond to fully integrate knowledge about trauma into our schools and classrooms, procedures and practices. And we need to resist re-traumatizing our students as well as the adults who care for them. So through mindful practices, we can grow our windows of tolerance so that we are better able to cope with challenges. With meditation, yoga, qigong, tai chi, you can work with your students to help them build that window of tolerance. Research shows that our stress can have direct effect on our students and colleagues, and enhancing educator well-being has positive effects on student outcomes and relationships with colleagues. Short practices of yoga and mindfulness activities and Qigong have shown to reduce educator stress and anxiety and increase overall well being. And yoga, mindfulness, Qigong, meditation practices also increase empathy, gratitude, and social and emotional well being. Through mindful somatic approaches, we can grow our windows of tolerance so that we are better able to cope with challenges. Dr. van der Kolk mentioned that perhaps the most important contribution the therapy world, including the field of trauma, can make to the wider culture is to give people greater access to their innate self regulatory systems, the way that we breathe, the way that we move, the way that we sing, the way that we interact with one another, so that they can discover their natural resources to heal and regulate in a different way, especially when life gets challenging. We can do that through the various mindful and grounding practices, breathing, through social and emotional learning, etc. Mindfulness and other practices can help to change the physiological states left behind by trauma. These practices might take time to cultivate, but they do help us work through our traumas, allowing us to become comfortable with being in the present moment and being able to stay embodied rather than to disassociate from our bodies, which is a common practice for trauma survivors. These practices can help us to feel into the body, into the places that truly have no words to express what they have experienced in a traumatic event. We don't want to force the experience of excavating trauma on ourselves or others. Instead, we want it to be an organic, emergent process of something working its way out or transforming into a space of understanding, empathy, and compassion in its own time, giving it patience as we practice self compassion and self inquiry in gentle ways throughout our healing process. The wheel of awareness, which is introduced by Dr. Dan Siegel, who we've talked about before, is a tool to help create more well being in your life. It helps you to focus and direct your awareness. The metaphor is that of a bicycle wheel, and all along the rim are places where you can direct your focus, accessing those moments through a quote unquote spoke of attention. The hub represents the experience of awareness itself, which is your knowing, while the rim contains all of the points of anything we can become aware of, that which is known to us. We can send a spoke out to the rim to focus our attention on one point or another. In this way, the wheel of awareness becomes a visual metaphor for the integration of mind, body, and psyche. To start out with the wheel of awareness, let's do a grounding experience by exploring our first 5 senses without judgment. Take a moment first to notice 5 things around you. Now, take a moment to touch 4 things around you. Take a moment now to acknowledge 1 thing you can taste. Take a moment to acknowledge 3 things that you can hear. Take a moment to notice 2 things that you can smell. After taking time to work on the first 5 senses, we might move on to the 6th sense, which is bringing awareness to any physical feelings in the body. Take notice of any physical feelings in the body. Again, not judging those feelings, just noticing. Then we might do some meditation, moving on to the seventh sense, taking notice of any mental activities, letting them pass through, and again, not judging. And then moving on to the eighth sense, which is our interconnectedness, where body and mind are noticing each other.
I invite you to continue to build your mindfulness practice using techniques like this one. Now we're going to move on to
A loving kindness meditation that will help promote connection, compassion, heart-centeredness, forgiveness, restoration, and centeredness. This is one of the practices that can be found in our wellness library at Wellness for Educators. It's a $25 a year membership fee for access to the wellness library, and you also get discounts on our book clubs and everything, all of the other events that we have. So feel free to check it out at wellnessforeducators.com. So we're going to start off by either sitting in a comfortable position or standing or lying down, whatever works best for you. If you feel comfortable to close your eyes, please do so, or you can leave them open. Again, choosing what feels okay for you throughout this practice. So first, you're going to think of an acquaintance, someone you see regularly, maybe at the grocery store, but you don't know them personally. Take 3 deep breaths in and out as you are picturing that person in your mind. Once you've finished up with that 3rd breath in and out, send the following message to them. And in between each phrase, take a deep breath in and out. May you be filled with loving kindness. May you be peaceful. May you be healthy. Now I'll move on to picturing a loved one. Take 3 deep breaths in and out as you are picturing that person in your mind. And once you've finished up that 3rd breath in and out, you'll send the following message to them. In between each phrase, take a deep breath in and out. May you be filled with loving kindness. May you be peaceful. May you be healthy. And now you're going to picture someone who is a little more difficult to be with. Take 3 deep breaths in and out as you are picturing that person in your mind. Once you've finished up that 3rd breath in and out, send the following message to them. In between each phrase, take a deep breath in and out. May you be filled with loving kindness. May you be peaceful. May you be healthy. And finally, you're going to picture yourself Take 3 deep breaths in and out as you are picturing yourself in your mind. Once you've finished up with the 3rd breath in and out, send the following message into your being, into your heart center. And in between each phrase, take a deep breath in and out. May I be filled with loving kindness. May I be peaceful. May I be healthy. And take 3 more deep breaths in and out to close your practice. I hope you've enjoyed this session. As always, you can join us on social media and sign up for our newsletter on our website at wellnessforeducators.com. Remember to fill your own cup first so you can fill the cups of others. I look forward to connecting with you for questions and conversation. Thank you so much.